Hello everyone, this is the Stetho student, and today I'll be presenting a detailed case study on the tuberculosis. We'll go step by step through the history, clinical findings, investigations, and managements. Let's get started. It's introduction. In introduction, you should write your name and you are doing which course with the slightly introduction of your patient. Then we move to the history collections. In starting, we write normal demographic data, or we can say identification data of the patient, like his name, age, gender, from which he came from, which chief complaints, like his X age and admitted in XYZ hospital on date this, and with the chief complaint of like I have written high fever with high fever, chest pain. Since you should surely write that since 68, since 10 days, since 10 days, etc. Okay, then we move to the history of the health. In history of the health, we write about present medical history and present surgical history, past medical history, and the past surgical history. In present medical history, you should write in your word, like in scientific word. My patient is this and this year olds with the chief complaint of this, and which doctor is treating him. With the surgical history, if there is present, you should write that and date. Okay, with the anesthesia name. Okay, and the dose of the anesthesia. Then you should write about the personal history of the patient, like his bad or good habit, dietary pattern, how many times he is taking the meal or not, and he's skipping the meal, like this. Everything you should write about his personal rest or sleep, elimination pattern. Okay, then you move to the family history of the patient, like the types of a family, nuclear family or a joint family, number of the family members, 6 member or 10 members, head of the family, who is the head of his family, and any hereditary disease, if there is any genetic disease present or not. Okay, then you should write all family member in a chart with age, education, occupation, and their health. You should remember that family history is always written in 3 generation, never forget that. Okay, grandfather, father, and then grandsons. Then you should move to the socio-economic history, like which type of house, pakka or kacha house, income, drainage system, open drainage, closed drainage, water supply जो है, everything. Then you move physical examination, vital signs. Remember, in vital signs, my teacher told me the vital signs are represented by the indicating colors: blue, red, green, black, and pink. You should surely indicate them with these colors. Then you head to toe examination, like head, ear, nose, eyes, mouth, and pharynx. Everything you should write about the eyes, nose. Okay, eyes, nose, and our head to toe, color, structure, everything. Then you should move to the systemic examination, like cardiovascular system, abdomen. You should you should do inspection, palpation, percussion, everything, to find out any abnormality are present or not. Like I have done, it's something is normal, you should normal. If there is abnormality, fine, you should write that, surely mention that. Okay, in genitourinary system, remember, in this, if your patient is female, you should also write the menstrual cycle, normal and abnormality days. Okay, after the systemic examination, you move to the investigation chart, and you can find every investigation chart in the file of the patient very easily, and you should mention in your case study. Then which type of tests are performed on the patient for his diagnosis and treatment. Then you basically write about the drugs. One or two is are sufficient with the contraindication, adverse effect, and nursing responsibility. We move to the description of the disease and conditions, where we write about the introduction of the TB, then definition of the TB, with anatomical and physiology of the lungs, because the TB occur in lungs. That's why I have written the anatomy and physiology of the lungs. If yeah, your diagnosis is MI, then you should write anatomy and physiology of the heart. Okay, This is the structure. This is the basic physiology of the lungs, like lung volume, tidal volume, residual volume, etc. Then types of tuberculosis, because you are writing the description about the disease, then TB is not only pulmonary type. There is various type of TB, like pulmonary TB, bone TB, abnormal, but in my case it's about pulmonary tuberculosis. Okay, then incidence of the pulmonary tuberculosis in the world or in the India. It is written mode of transmission of tuberculosis, incubation period of the tuberculosis, like from like period of the exposure, the symptoms shown in the patient's body. This is the pathophysiology of the TB. And etiology and risk factor of the TB diseases. In case study, we write clinical manifestation like this, like book picture, and another side with patient picture. Is present, then you should write present. If absent, you should write absent. Then diagnostic evaluation, what you have done and what have not done, like skin. In my case is tuberculosis skin test is not done, then I have written not done. Medical management, which medicines are given and in which dose, frequency and rate, matlab route of administration, that I have mentioned very well. And surgical management, if any surgery has done, you should write done on this date. If not, then not done. In the last, we write the nursing management. In nursing management, we should uh, we must write at least five nursing diagnoses. Okay, then I have write the diagnosis of the ineffective airway clearance, because it's related with our lungs. Then breathing pattern, alter body temperature, alter nutritional status and activity intolerance. Okay, then we move to the NCP. We have made NCP with assessment, subjective and objective data, nursing diagnosis, and remember that if we making the NCP, we should make according to the priority. Okay, it's ups and down in the video, but you should write very first this one ineffective airway, then you should write in ineffective breathing, then after these two you should write any of them, nutritional or body temperature. Then in the last we write health education, that we give to the patient for his better prognosis, for his uh, fast recovery from the disease he is suffering from. Okay, diet plan, first day we tell about his diet, what to eat and what to avoid in food. We maintain hygiene, medications, like uh, take all medicines on the right time in the right dose and don't skip any medicines. Then isolation, of course it's a communicable disease. Patients should live in isolation for some days. And after continued care, in the end we write about the summary, what from the starting point to the ending point, like Mr. Ramesh is diagnosed with this and with the same symptom of this etc. And he's went through the this and this diagnostic valuations, and he is good or not. In conclusion, we write about the TB, the patients. Then we write bibliography from which I have get this. Okay. Thank you very much. I hope you like this.